Okay, we're going to talk about health insurance. We offer several different plans. We have two PPO plans. One's called Key Advantage 250 and the other is Key Advantage 1000. They're both through Anthem. We also have a high deductible health plan, which is also through Anthem. And then our HMO, which is through Kaiser Permanente. And one thing I do want to highlight for everyone is that all of our plans include medical, dental, vision, and prescription coverage. So whenever you elect your plan, all of these items are included. So here's some insurance lingo. You're going to hear these words throughout the presentation. So I just want to take a quick minute to go over them because sometimes it just sounds like a bunch of gobbledygook. The first one is premium, and that is the amount that you will be paying every month for your insurance. Sometimes they also call it the rate. Then there's the deductible, and that's the amount that you need to pay for services before the insurance company will begin to split them with you. We have a plan summary, which is a booklet that's going to outline the services, the deductibles, the copays, and the coinsurance for the plan. The coinsurance is the amount that you're going to be paying after your deductible has been met. So once that deductible is met, then you and the insurance company share the cost. The copay is the amount that you're going to pay at the time of service. Then you have EE, which is employee, ER, which is employer, and then just our plan year, that's July 1 through June 30th. So I'm going to show you a very quick video. Because I am sharing my screen on Zoom, you guys can just click the little pink button and it will automatically play for you when you're on a PDF or the flip book. So let's just take a minute and check it out.
When choosing a medical plan, you sometimes have the choice of picking between an HMO, PPO, or HDHP plan. Let's talk about what these letters mean and the key differences in these types of plans. First, an HMO, or Health Maintenance Organization, is an insurance plan that may offer lower monthly premiums, the cost for the insurance, but also gives you fewer choices regarding where you can receive care. The insurance provider has a list of approved doctors for you to choose from to receive coverage, meaning there are some doctors you cannot visit using your HMO plan. With an HMO, you must designate a primary care physician, or PCP. Think of your PCP as the main doctor you visit for routine medical care. With most HMOs, you must first visit your PCP and get a referral to see any specialists you may need to visit. And with an HMO, every time you see your primary care physician or a specialist, you pay a predetermined flat amount called a copay, no matter how many times you visit. A PPO, or Preferred Provider Organization, is a plan that gives you more freedom to choose from a larger pool of providers, but generally comes at a higher monthly cost. While the network is larger in a PPO, there are still providers that don't fit in. You can choose these out-of-network providers and get some coverage. However, you usually end up paying more for those services. PPOs do not require a primary care physician, therefore eliminating the need for referrals and giving you the ability to go directly to a specialist. Finally, an HDHP, or High Deductible Health Plan, is a different type of plan altogether, aimed at giving you the most control over your health expenses. HDHP medical plans typically offer the least expensive monthly cost for coverage, but require you to pay all of your healthcare costs that are incurred until you meet the deductible that is listed on the plan. These plans keep your costs low if you don't utilize it a lot, but keep you financially protected in cases of catastrophic illness or emergency. HDHPs are similar in structure to a typical car insurance policy. For example, if Bob's Auto says it will cost $5,000 to fix your car after an accident, and you have a $2,000 deductible on your auto policy, you will be required to pay $2,000 and the insurance company will pay the remaining $3,000. The higher the deductible you choose for your medical plan, the smaller the monthly cost will be. But it also means when you have health expenses, you are responsible for all the costs up to that deductible amount. Generally, HDHPs use what is called coinsurance to determine how much you pay for services after you meet your deductible. This is the percentage of a bill that the insurance company will pay at that time. For example, after hitting your deductible, if you get a medical bill for $1,000 and your plan has a coinsurance benefit of 80%, the insurance company will pay $800 and you must pay $200. The coinsurance eventually stops and the insurance company starts to pay for 100% of all healthcare expenses when you have personally spent the amount listed as the out-of-pocket maximum on the summary of benefits for your HDHP plan. To sum it up, HMOs offer lower monthly premiums but limit the choices you have for doctors. PPOs offer more choices for doctors, but typically cost more on a monthly basis. And HDHPs provide the most flexibility for you to manage your healthcare costs, typically offering the lowest monthly premium, but requiring you to reach a deductible before benefits become effective. And now you know the differences.
Okay. So hopefully that helped explain the differences between a PPO, HMO, and high deductible health plan, to help you kind of narrow down maybe what you really want to be looking at. I also have other benefit videos, understanding your insurance, Anthem, Kaiser, and I have some standalones. I also have Flexible and Aflac in here as well. But really, I recommend checking out the health insurance videos. They're pretty helpful. I also have some other short videos that you can check out. There's the link here, but there's also the QR code to help explain the differences between a PPO, HDHP, and a PPO, HMO. So for health insurance and standalone plans, there's the plan summary. And as I had mentioned before, the plan summary provides you with a breakdown of the services that are going to be covered by the plan and basically how the plan works. So if you click on the link right down here, it's going to take you to the health insurance and standalone plan summaries. It's going to look something like this. So you'll have your cover, and then when you go on the inside, it's going to give you a breakdown of your copays, co-insurance, deductible, and the services that are offered. For the health insurance, you guys have 30 days to submit your form and other supporting documents. And if you miss that deadline, then you have to wait for open enrollment, or if you have a qualifying event during the year, it will allow you to make a change outside of that open enrollment period. An example would be having a baby, getting married, getting divorced, a dependent passing away, a dependent turning 26. So there's a long list that will allow you to make a change mid-year. If you're going to be adding a dependent, in addition to the enrollment form, I will need supporting documentation. So if you're going to be adding a child, I need a copy of the birth certificate. And if you're going to be adding a spouse, a copy of the marriage license. And if you click down here below, it will have the form for you to enroll in health insurance. But I also have it in a separate section in this presentation. Just some more information. So MCPS health plans, they do have a 30-day waiting period. So your plan coverage is going to be effective the first of the month following the end of your 30-day waiting period. And we are billed a month in advance, so we pay a month in advance, which means the deductions that are taken, let's just say for the June 15th and June 30th payroll, are really there to pay for the July insurance. So that does and can lead to adjustments being needed for new hires. So we do strongly encourage you to get your forms turned in within that 30-day waiting period, to help avoid or eliminate or decrease the amount of adjustments that may be needed to get you caught up. So it's going to be 3 steps, and one thing I wanted everyone to see is a spreadsheet that I created so that you would have a visual and be able to look at the different plans and the prices and just see how dates and when you turn things in are really going to be able to make an impact on any adjustments that you may need. So let me just share my screen. Now, this is a Google Doc. So when you click on that, click here, it will take you to this. And if you click open with, I want you to go to Google Sheets. And now you have the ability to use the spreadsheet. So the first thing that you need to do is you need to find out what kind of, find your contract. So I have a 10-month new teacher, which many of you will be. But I also have listed all of our support and licensed contracts as well. Now, what this does is it will generate your first day of work. It's going to generate your 30-day waiting period. It will tell you when your insurance will start, and it also includes your first paycheck. So the second thing that you want to do is you want to go down here and you want to use the drop down to find the level of coverage that you are interested in electing for health insurance. So I'm going to pick family. Here are all the plans. Then it tells you the full cost of the plan, how much the employer is going to be contributing on your behalf. But then we broke it down so that you can see the monthly amount for the employee, but also the per pay for the employee. So once you know what level and which plan you want, come down to step 3. You're going to make that selection. Let's see, what did I do? 250 family. And it's going to generate more information for you. And basically what this is showing is and these dates can change because it really all depends on when payroll runs. So, you know, the possibility that it could run a day or two later, it's possible, but this should give you a very, very good idea of when we're going to need things by and how your adjustments will play out. So if you turn your form in before August 6th, and this is for a 10-month new teacher, you will begin to have your deductions taken out starting with your first paycheck, which is the 8/13 payroll. Then you're going to see that it will be taken out regularly moving forward. The reason why I show this is because, remember, we are billed a month in advance. So with your insurance starting September 1st, these two deductions here in August are paying for that insurance. The deductions in September are paying for October, so on and so forth. I wanted to show you if you were to submit your form and documents after this payroll has run, but let's say before 8/24, it might look like this. So you missed that 8/13 payroll, it wasn't turned in prior to it running. So no deductions were able to be taken. So you will have it in before the 8/31 payroll. So what they're going to do here is they're going to double it for that missed deduction that you had on the 13th. Because remember, August pays for September. Your insurance is starting in September. And then moving forward, it's just going to be, you know, the normal amount. Let's say that you enroll after the 24th or after the 31st payroll, but before September 10th. It's probably going to look like this for you. So you missed the 8/13 and the 8/31 payroll, which means those need to be caught up. So on the next two payrolls, which is your 9/15 and 9/30, you're going to see a double deduction. Okay. Remember, August pays for September, September pays for October, but there were no deductions in August. So you're getting them caught up on your September. Now, if you were to turn it in after this 9/15 payroll, but before the 9/30, before 9/21 for that 9/30 payroll, you're going to see that you've missed those 4 payrolls. So you will have a very large adjustment on that 9/30 payroll. So this is just to show you, really it is beneficial to get it turned in as soon as you possibly can to help, you know, eliminate or even possibly avoid having to have double deductions or more based on when you turn it in, because we pay a month in advance and we deduct a month in advance. So there's that spreadsheet for you guys. Hopefully it will be beneficial. And this screen, it's just telling you the different scenarios and basically what we just went over. So health insurance rates, I have them broken down here. You can see here is the plan. Here's the coverage level or tier. Here's the full amount. Here's the amount that the employer contributes on a monthly basis and how much you as the employee are going to contribute on a monthly basis. Now remember, we're paid bi-monthly, so please take that number and divide it in half to find your per pay amount. You're going to notice that a lot of our plans have, well, all of our Anthem plans have a 250, a comprehensive and a preventative option attached to each plan. If you click on the link down here, it will take you to a booklet that we're going to look at on one of the next few screens, as well as a QR code Here's a QR code to get you to these insurance rates. And I do have them also in our Google Docs and additionally further in the presentation. So let's just talk about the different plans. So we have our Kaiser plan, and they have 36 medical facilities in Maryland, DC, and Virginia. This is comparable to the monthly premium of our PPO plans. One thing I do want you to note is that this plan does not have a deductible to be met, which is great. It does still have your copays and your co-insurance. The plans, it's easy to use, it's convenient. You choose your medical center, you elect a primary care physician, and that person will, basically coordinate all your healthcare services for you. So it's kind of like a one-stop shop, because some of the things that you're going to find at your medical center are things like radiology, labs, pediatrics, OBGYN, and a lot more. If you need to be seen by a specialist, you will have to get a referral from your PCP. Now, the dental administrator for our Kaiser plan is Dominion National Dental, and the vision administrator for this plan is Vision Essentials by Kaiser. Here is a list of just, some of the kind of cool perks that is to being a Kaiser Permanente member. They also have something new called ClassPass, and it's where you can do on-demand workout videos, which is kind of cool. And you can also do in-person gym classes for a lower rate with any gym that's partnered with ClassPass. Say that 5 times fast. Now we're going to talk about our Anthem plans, the PPO and the high deductible health plan. So all of the Anthem plans have the same medical, vision, and prescription coverage. The difference between these plans is the premium, the deductible, the copay, and co-insurance, along with the level of dental. Now, when you pick an Anthem plan, I just want everyone to know that when you receive your card, you're going to use that card for all of your services. So you're going to use it if you go to the dentist, you're going to use it if you go to the doctor, you're going to use it if you go to CVS and pick up a prescription, and you're going to use it when you go to have maybe classes or a vision exam. All of the cards will have your name on it because you are the policy holder, but your dependents are able to use that same card. So here's just a visual trying to break down something that can seem kind of complicated a little more simply. So you have your 250, your 1000, and your HDHP. So, like I said, the medical services are all the same. The vision services are all the same. The dental, this is where you get to pick preventative or comprehensive. The premium. For the 250, the premium is higher than the 1000 and the high deductible health plan. Your deductible is lower than the 1000. Is lower than the 1000 and the HDHP. And then you're just going to want to look at the plan summary to get all the information of the breakdowns of the copays and co-insurances. Your 1000, again, has all those same services. You pick how much dental you want. The premium is going to be lower than the 250, but higher than the high deductible health plan. The deductible is higher than the 250 and it's lower than the high deductible health plan. If you were to do the high deductible health plan, again, same, you pick your dental. This one has a lower premium than both the 250 and the 1000. It does have a much higher deductible than the 250 and 1000, which is why, again, your premium is going to be so low for this. So these plans, basically really provide you with flexibility because you don't need to have a primary care physician. You don't need referrals to go see a specialist. It's really easy to use. You're going to want to use in-network doctors when you make your appointments. These plans do have annual deductibles, copays, and co-insurances. So you'll want to make sure that you check out the plan summary. And if you want to find out if your doctor is in network before you select an Anthem plan, you can click on that link there when you are using the PDF or a flip book, and it will take you to a website where you can enter the information in. The dental administrator for an Anthem plan is Delta Dental, and the vision is with Blue View Vision. So like I mentioned earlier, you're going to notice that we offer 2 of each plan. For example, the 250 comprehensive and the 250 preventative. So they both have the same medical, vision, and prescription coverage. The difference with this is the amount of dental that they offer. So if you're someone who, just wants your 2 cleanings and, fluoride and an x-ray, then, a preventative plan is going to be for you. If you're someone who wants those preventative services, but also coverage for like primary, major, and orthodontic services, then a comprehensive is what you're going to want to elect. So let's just look at the details. So you'll see here's the breakdown. You can click on the link at the bottom there when you go on the PDF or the flip book, and it will show you a version that might not have the print as small and or blurry. But you're going to notice here at the top, this is your preventive coverage. So here are the services that are included at 100%. Now, selecting a preventative plan does cost a little bit less than your comprehensive. And here's why: because it has more coverage. The coverage for the comprehensive plan has your primary, major, and orthodontic services. So if you get a cavity and you need to have a filling put in, well, I think it's called fillings. Filling put in, anyway, a service. Then you're going to notice here that Delta Dental will share the cost with you, a co-insurance. So they pay 80% and you're going to pay only 20%. So you will notice that the comprehensive plans do cost a little bit more, but the reason why is because it does have more coverage. And then here are just some Anthem perks. One thing I do want to point out is if you are someone who is starting a family or considering starting a family, if you do our Future Moms program, then you would be able to get the hospital fee waived for when you go to have your delivery. And in order to have that, you do have to enroll in a Key Advantage 250 plan. It only applies to that plan. And then there's apps and Live Health Online. I love it. I use it all the time. And then they also have home delivery for your for pharmacy. And the nice thing about that is it will send you a 90-day prescription and you only pay for 2 months worth of medication. So there is a required form. We do have to have this regardless of whether you are or are not enrolling. You're going to see here that you're going to put your information at the top, sign and date. Then you're going to go down here. You're going to go to letter A, do initial enrollment as employee, put your date of hire, then turn the form over. And on the back side, you're going to put your information in part 3. And then in part 4 is where you're going to elect to either A, waive, or B, select a plan. And this is a state-run program. So you will notice that there are some plans listed on the form that we have not gone over. The reason why is we do not offer those plans here. So please make sure that you're checking them out and going and electing one that we have reviewed here. So next we have our standalone plans. And so this is for anyone who has waived insurance with us, or maybe wants just some dental and or vision coverage. We have a standalone Delta Dental plan, and it's our PPO Plus Premier plan. This one does have an employer-employee cost sharing, and it will be done through payroll on a pre-tax basis. Remember, we do things 1 month in advance for your coverage. And if you have health insurance with us, you cannot enroll in this standalone plan. When you're on the PDF or the flip book, you're going to be able to click on the link below and it's going to take you to the plan summary. Then we have our vision services plan. It's our standalone vision plan. And this is one that anyone is able to enroll in. It is 100% employee paid, so there is no employer portion to this. And we do hold premium 1 month in advance because we are billed and deduct 1 month in advance. plans. And then at the bottom here, you can click to see your plan summary and the coverage that it has. Here are the rates for our standalone plans. You have the full monthly amount, how much we as the employer are going to pay, and then how much you as the employee will pay. And these are on a monthly basis, so just divide it in half because you're paid twice. And if you go down to the bottom here, you can click to view these rates in the Google Drive. So our health plans include an employee assistance program, but we feel like it's a really important program. So we have gone ahead and partnered with them, and we paid to have coverage for everyone. So regardless of whether you have insurance with us, you will be able to use our EAP program. And it's going to cover you and your dependents, and it provides, counseling and resources and help just to kind of have a healthy work-life balance. It'll do 4 free counseling sessions per incident per plan year, but it also has a lot of other components to it. There's work-life balance, there's substance abuse, financial and legal help, credit monitoring, budgeting, meditation, talking about retirement, elderly care, child care. So it's really something that you're going to want to take a look at because it is so much more than just being able to see a counselor. So you can either log into MyMCPS or you can click at the bottom there to learn more. Next up is flexible spending.